My views are a little bit out of the ordinary because we are talking about using evidence to close the implementation gap. And when you look at the evidence that we have invested heavily, we've done a lot of piloting, we've done a lot of experimentation, and yet the health outcomes for the people whom we are serving is really very minimal, and the question is why. And with that searching, I came to the conclusion that there is one social determinant that we are not addressing, and that is the psychological emancipation. And that cuts across the global health community itself, national health communities, and the communities themselves. And my view is that we need to free ourselves from our own strongholds of the way we think, the way we act, and the way we believe that this will only work if we do it this way. If we care to reflect and stand aside, we could probably catalyze a lot more action at community level and actually transform health and health outcomes if we dealt with that social determinant. It is hardly ever addressed. You have heard of the Blair Commission for Africa. You have heard about the social determinants of health. There is a Millennium Development Goals, and none of those issues look at the value of psychological emancipation in development, and especially in development of health outcomes. And this is an issue that I hope the health promotion fraternity will pick up and run with. Challenge ourselves to be able to psychologically free ourselves. If we did that, we would bring into the arena totally different players and actors in the health promotion struggle. We will look at groups like, for example, the press. They have the means, they have the power, and they have the clout to actually influence and inform policy. They have changed global policies on certain issues. But when they come to report on health promotion actions, they only come when the dignitaries are talking. But when the real good news from the communities is put on the table, the lenses are long shut. And what we are saying is, rather than them just reporting what we consider as bad news to us as their good news because it's breaking news, I would like us to engage them and revert the way they report on health outcomes and look at the good news from the community as breaking news. I know it doesn't sell in the context of the current fourth estate, and that's why I'm talking about psychological emancipation.